Welcome to this afternoon's meeting of the Lincolnshire Health and Wellbeing Board. We shall now start with agenda item 1, appointment of chairman. Please may I seek nominations for the chairman of Lincolnshire Health and Wellbeing Board for 25-26, please. Councillor Hume.
Yes, I'd like to nominate Councillor Clegg, please.
Thank you for that. So that's a nomination for Councillor Clegg. Please may I have a seconder? Councillor Gibson.
Thank you. Yes, I'd like to second that.
Thank you. That is carried. Chairman, would you like to join me in the chair? Thank you.
Good afternoon, everybody. Thank you for placing your confidence in me. Some faces I do recognise, some I do not, but I look forward to getting to know those of you I already know better and those I don't know a bit better as we move on. So as with every meeting, I'd like to start with a health and safety announcement. There will be no fire drill planned this afternoon, but in the event of the fire alarm sounding, we will need to leave the council chamber through the rear doors and leave the building through the reception into the front car park, where we will then need to wait in the car park until further instructions. And can I please remind everybody to ensure that their mobiles and other devices are switched to silent, and when you are invited to speak, can you please ensure that you switch on your microphone? Otherwise, those attending the meeting via Teams and members of the press and public listening to our meeting won't be able to hear you. Please be aware that you need to speak directly into the microphone to be heard. If you wish to speak during the meeting, can you please raise your hand and Alison will take a note. We shall now move to item 2, appointment of vice chairman. Right, item 2, appointment of vice chairman. May I seek nominations for vice chairman for 2025 to 2026? Karen Dunderdale.
Yeah, thank you, Chair. I'd like to nominate Claire Rowbold, who's the Accountable Officer of Lincolnshire ICB. Thank you.
Thank you, and do I have a seconder? Thank you. Are there any other nominations? In which case, that is carried. Thank you. We now move on to item 3 on the agenda. Jess, have we received any apologies for absence or replacement members?
Thank you, Chair. We've received apologies from Councillor Lee, District Councillor Wright and Kevin Lockyer, and I believe Alison Christie would like to come in.
Thank you, Chair. Just Claire Raybold's unable to make the meeting today, but she has sent a letter to ourselves and DEM Services confirming that she's happy to be nominated and be elected as Vice Chair of the Health and Wellbeing Board. And Matt Gaunt is her designated representative for this meeting. So if Matt is able just to take the Vice Chair's chair.
Sorry, thank you, Alison, for that. Yes, sorry, I jumped ahead there slightly. Yes, Matt, if you'd like to come and join me. Right, moving on now to item 4, declaration of members' interests. Are there any members who would like to declare an interest for any of the papers? None. So if throughout the meeting you realise you need to declare an interest, please indicate and we will ensure that it is duly noted. Thank you. Moving now on to item 5. Minutes of the previous meeting. This is to confirm the minutes of the meeting held on the 10th of December 2024 are an accurate record, and these can be found on pages 5 to 10 of the agenda pack. Do I have a proposer? Councillor Woolley, thank you. And a seconder, please. Karen Dunderdale, thank you. All those in favour? Thank you. Any against? Any abstentions? Thank you. Those minutes are agreed. Thank you. We're now moving to item 6, and you are now invited to note the actions updates as circulated on pages 11 to 12 of the agenda, and these are for noting. And if people are happy with that, if they could just indicate by raising their hands, please. Thank you. That's noted. Thank you. And now on to item 7, Chairman's announcements. Now, I hope you have had the opportunity to read the Chairman's announcements circulated on pages 13 to 14, and these are for noting, and I trust you will be pleased that I am not going to read all of those out, but if I may indulge just momentarily, I would like, on behalf of this board, to acknowledge John Turner's contribution. Obviously, he's just retired as Chief Executive of the Lincolnshire ICB, and I would like to express our gratitude for his contributions. I have met John a couple of times, and I found it to be extremely helpful in the short time that I knew him. And I'd also, if I may, just like to welcome Claire Raybould, who, as we know, is not here today, as in her role as Chief Executive and also as a member of the Health and Wellbeing Board and the ICP. Thank you. We now move to item 8A, item 8A, which can be found on pages 15 to 28 of the agenda pack. This item asks the board to review its governance arrangements, reaffirm its terms of reference, and approve associate membership for the board for 2025 to 2026. And I would like to now invite Alison Christie, Head of Prevention and Oversight, System Oversight, to present the report. Thank you, Alison.
Thank you, Chairman. So the Health and Wellbeing Board is a formal committee of upper tier local authorities who have responsibility for children's, adult care and public health. It's a forum that brings together political, clinical and professional leaders to come together to improve the health and well-being of the population. The functions of the board are set out in sections 195 and 196 of the Health and Social Care Act 2012. So we've had a Health and Wellbeing Board in Lincolnshire since 2013. Its primary functions are to prepare and publish a joint strategic needs assessment, and then to use the evidence in the GSNA then to inform a joint health and wellbeing strategy. The terms of reference are set out in the appendix to the report, details the roles and responsibilities, and sets out the core membership of the Health and Wellbeing Board. So as a legal minimum, we're required to have at least one elected councillor, a representative from the Integrated Care Board, the directors of Children's Services, Adult Care and Public Health, and a representative from the local Health Watch organisation. Representation beyond that is then for local determination to decide additional membership. We also have the provision of inviting associate members onto the board. So these are partners and organisations that would be beneficial to have round the table, but don't have voting rights. So in the second half of the paper, it notes the representation that we would like to invite on for a further year as associate members. So we review the terms of reference on an annual basis. So since the review of last year, there have been no sort of statutory or required updates to the terms and conditions of the Health and Wellbeing Board, but the details have been updated in section 1.5 to show the change of elected representation following the county council elections in May. So I'd like to ask the board just to reaffirm the terms of reference for the coming year.
Thank you, Alison. Thank you for that clear explanation. Does anybody have any questions for Alison? No? Okay, well, again, thank you, Alison. The actions we are now required, or invited rather, to endorse the terms of reference and governance documents as attached in Appendix A, and to approve associate membership on the Health and Wellbeing Board for 2025 to 2026, as detailed in the report. Is there a proposer and a seconder? Could I have a proposer, please? What's up? Councillor Gibson, thank you for,
Yeah, happy to propose, Chairman.
and if I may, I'm happy to second if I'm allowed. I will second that then, thank you. All those in favour? Any against? Any abstentions? Thank you, that's agreed. Thank you. Right, moving swiftly on now to item 8B, the Lincolnshire Pharmaceutical Needs Assessment for 2025. This item can be found on pages 29 to 256, quite a big document of the agenda pack. Members are invited to approve the final pharmaceutical needs assessment for 2025 prior to its publication on the 1st of July of this year. I'd now like to invite Derek Ward, Director of Public Health, to introduce the item before handing over to Tony McGinty, Public Health Consultant, to present the report on behalf of the Pharmaceutical Needs Assessment Steering Group. Thank you. Derek.
Thank you, Councillor Clegg. The pharmaceutical needs assessment, as outlined in the previous item, actually, is one of the statutory responsibilities of the Health and Wellbeing Board, and we regularly keep an eye on it, and then we have a statutory responsibility to update it. Tony and Alison have led that process for the current update. Previous papers have come through the Health and Wellbeing Board, so that the board were updated as to where we were. We now have the final version, so I'll hand over to Tony to pull out the salient points on the final version before he passes back to you. Thank you.
Thank you, Derek. Thank you, Tony.
Thank you very much, everyone. Good afternoon. I had the pleasure of chairing the steering group that's responsible to support the board to develop a pharmaceutical needs assessment each period. So happy to be here to present it to you today. As the chair has already noted, it produces a very large, very complex, technical and detailed report, which is fundamentally what is required of it for it to fulfil the function that it's supposed to fulfill, which is to describe the current and future needs for pharmaceutical services for the 800 or so thousand people who live in Lincolnshire, both now and for the 3-year planning cycle of the pharmaceutical needs assessment. This report is meant to last for 3 years and describe anything that we think needs to change, be added to, so any gaps in provision, any changes in provision that we think are required to meet the needs of local people over the next 3-year cycle. I'm sure having read it, you'll notice it is quite technical and quite difficult to read. It's certainly not bedtime reading, and that's because it's very much prescribed by the regulation that requires us to do it, exactly what is meant to be included in it in really significant detail. So I'm not planning to try and walk you through 100 and odd pages of that detail this afternoon, but what I can do is highlight some of the key points for the board to consider in making its decision about whether it believes this is now ready to publish or not. So I can confirm that we have followed the mandated statutory process for the formulation of the needs assessment. It has to be led by a steering group, which has to have certain stakeholder groups represented on it, and I can confirm that is the case. So general practitioners, community pharmacies, as you would expect, the local health watch organisation, local public health leaders are required to be part of that process, and I can confirm that has been the case throughout, both in terms of designing our process, producing the first draft, which came to the board in December for publication for consultation, and the steering group met again to consider the consultation that we received from 3 main sources, which I'll mention in a moment, to decide whether we thought anything from the consultation meant that we should come to a different conclusion about whether there were any future gaps or current gaps in pharmaceutical access for people. Some of the things we are allowed to do in the report, which I'll just point out to you for a second, we're allowed to decide what we think reasonable access is for access to pharmacy services. We've gone largely with the general national view about how this is judged, which is 20 minutes journey by car as the standard that we measure access to community pharmacies against. So you'll see that 20-minute referenced over and over again in the report when we're analysing access. And for clarity, where 20-minute access isn't achieved over the 7-day week period, we've identified what is being achieved in quite low levels of detail in terms of which parts of the population are and are not able to gain that access. The other thing we're allowed to do is decide what localities we want to base our pharmaceutical needs assessment on. We went with district councils as that unit of place inside the county of Lincolnshire, just because it's very familiar to everybody. People understand the district council structures as they stand at the moment, more than any other reason about similarities in the population or anything else in those areas. So having done the first draft of the document, we brought it to the board, and at that point we concluded that having looked at accessibility across a range of different service types that pharmacies, GP dispensers and others provide, that there were no significant gaps in access for the people of Lincolnshire. Now, that doesn't mean that nobody is ever outside of the 20-minute access standard that we set, but it means that most of the population, most of the time, is within that 20-minute gap. And to give you a bit of a feel for that, about 4,100 people or so we found repeatedly to be outside of that 20-minute accessibility standard, and they were the same two places, the most remote bits of Lincolnshire, if you like, struggled somewhat with that, but that's 4,100 people of 780,000 people not meeting that accessibility standard. So just to give you a feel for why the steering group felt that wasn't a significant problem, and there wouldn't be an economical way of fixing that problem anyway, just because of the very small numbers of people involved in them. We tested that over office hours, weekdays outside of office hours, Saturdays and Sundays, to just test that the various opening hours of the various pharmacy dispensers didn't suddenly create a large gap at a particular time on a Saturday or a particular time on a Sunday. And again, we didn't find any particular significant gaps, although again, not everybody was within a 20-minute accessibility standard, 7 days a week, 24 hours a day. I guess as the board would expect, that would be an unusual thing to try and achieve. So in terms of the consultation feedback, we did some pre-engagement in planning the work on the needs assessment to make sure we asked any really important questions that we might not have answered otherwise. We took that on board. We did some online consultation work and received, a lot of people looked at that consultation, but we received a relatively small number of people who actually returned information to us. About 49 or so people actually wrote back to us on that system, and we also benefited from some more qualitative, so face-to-face work that Healthwatch, the local Healthwatch organisation, did for us. So we've got a bit of really granular information from people who were in a room talking to colleagues, and some numerical information from people who looked at the documents and replied to us through our standard council online system for engaging with the public on things. By and large, the feedback was generally good. People like community pharmacies, they valued them, they've generally found them to be really useful and helpful. When they were asked about the kind of accessibility they wanted, obviously convenience, locality and opening hours were some of the key questions which are part of the P&A kind of ask process anyway. And the majority of people were already identifying at that stage that they could get access to pharmacy when they needed it, although there is some feedback from some very small communities saying that they didn't feel they had that kind of access, which is kind of what you might expect by and large. A lot of the commentary from the public consultation, the online consultation, was somewhat clear that the public who'd read the document didn't understand fully what it was for and what the questions were about that they were being asked, and that's unfortunately the technical nature of the document, which is why we do some more qualitative work to talk to people more directly about it as well. Although we did get quite a lot of useful commentary from there, and as I said, we've considered that commentary as a steering group. Responded to those respondents where they've made points that we could respond to and taken on board what they said, in considering again whether we thought there were any gaps in provision now or gaps that would arise over the next 3 years or so. And you'll see from the report in front of you that we've actually concluded there aren't any gaps now or gaps that we expect to arise significantly over the next 3 years. The only caveat to that really is to keep a watching brief on the speed of housing redevelopment that now occurs in Lincolnshire, because our assessment of the housing redevelopment activity indicated that whilst there was development, there wasn't enough development in one place or one area of Lincolnshire to drive a significant uplift in the demand for community pharmacy services. Obviously, if the pace of housing building, especially some of the bigger planned developments, picks up significantly over the period that we're talking about, then we may well need to relook at that. And we have a mechanism for checking that our original thought on whether there were gaps or not still stands. And we've got 2 ways of dealing with that. We can write a factual update of the document itself with approval of the board. But if that looks like it is indicating that there is a significant gap has opened up, then the regulation generally would require us then to redo the PNA earlier than the 3 years mandated cycle. If we wanted to change our opinion particularly significantly, we'd have to have a look at the document again. So I'll stop there if I may, and just say the steering group recommends to the board that it agrees to publish the report as is presented to you today. But obviously that is the proposition to the Wellbeing Board.
Thank you, Tony, and thank you, Derek, for introducing it. Do we have any questions? Councillor Woolley.
Thank you, Chairman. Tony, can I just check with you? On page 19 of the document, that's page 53 of the papers, under 1.4.4, dispensing GP surgeries, that second paragraph says people defined as rural in character who live more than 16 kilometres from a pharmacy. Are you sure 16 is right? Because I was going to say, I think that... Thank you. Okay, thank you.
Thank you for drawing our attention to that, Councillor Woolley. Can we make a note to make an amendment accordingly? Thank you. Any other questions? Councillor Collier.
Yes, I was just interested to know, do you have enough pharmacists themselves? Because I know our pharmacy was closed for a little while, only a few days, but enough to cause a bit of a queue and a bit of a row outside as well. That's in Lincoln here in Birchwood.
I think in short, no. We don't have enough trained pharmacists to fulfil every role in every pharmacy in the county, and that makes the staffing fragile. So if someone is away on an unplanned basis or someone leaves a role, it can be difficult to replace them. So I think that's true of the NHS workforce quite broadly, but it's certainly true of community pharmacies.
Any other questions? Well, thank you for the presentation. As you said, it is quite a meaty document. I have, in a previous life, represented the district council here when the PNA was previously brought to the board, and I recall the drive by district councils to say, don't forget our value, which you've raised in what you were saying. I'd be quite interested at a future stage, not for this particular meeting, but to perhaps look at some broader aspects to do with community pharmacy provision, and also online pharmacy provision, if I may. But that's for future reference. Sorry, Derek Ward.
Thank you, Mr. Chairman. Yeah, we're happy to put that on the forward plan, and it has been a conversation before, probably between ourselves from a public health perspective with colleagues from the ICB and the NHS, and we could pull together a joint paper that broadens out what the PNA, as Tony's described, is a very specific document that needs to tick a lot of boxes, but we've had conversations previously around pharmacy provision in a broader sense, so we can scope that out.
Okay, thank you for that, Derek. So coming back to the recommendation to approve the final Lincolnshire Pharmaceutical Needs Assessment and associated documents for 2025 for publication on the Lincolnshire Health Intelligence Hub before the end of September of this year. Do I have a proposer for this? Councillor Woolley, thank you. And a seconder, Councillor Hume. All those in favour, please raise your hands. And thank you. Any against? Any abstentions? No, thank you. That's agreed. Thank you very much. So we'll now move on to item 9, which is the Lincolnshire Better Care Fund update. And this can be found on pages 257 to 280 of the agenda pack. And members are invited to note the update. And I'd now like to welcome Martin Samuels, Executive Director for Adult Care and Community Wellbeing, and Paul Summers, Programme Manager for Better Care, for the Better Care Fund, to present this report. Thank you.
So thank you, Chair. So I'll just say a couple of words of introduction before handing over to Paul. So the Better Care Fund has been around for about 10 years now. It's a national policy between the Department of Health and Social Care, the Ministry for Housing, Community and Local Government, and NHS England. It's designed to promote joint working between the NHS and local authorities, and I phrase that deliberately, so it's not simply meant to be between the NHS and adult social care. It is between local authorities more broadly. There is a minimum contribution that is set nationally, which comes from a combination of NHS funding through the Integrated Care Board, through funding given directly by the department to the local authority through the improved Better Care Fund, and that also includes the Disabled Facilities Grant, which is required to be then passported straight through to district councils for their housing responsibilities. Lincolnshire is one of the relatively few areas in the country which then also adds voluntarily to the amounts put into the Better Care Fund, and in this case we make contributions in terms of mental health and learning disability, but those contributions are under review to make sure that they meet the needs of Lincolnshire residents. So the aim of the Better Care Fund is to improve the system across the health and social care system for avoiding the need for long-term care, and then also to protect core adult social care services. It's an annual plan that is subject to national approval. It is a complex process, and the timings involved rarely fit with anything local, hence why we actually need a programme manager to keep a track of all of these things. So hopefully I haven't stolen everything that Paul was going to say. I'll ask Paul to just summarise the key points of this particular document that's put in front of the board for approval. Paul.
Thanks, Martin. So I'm just going to give a bit of a brief overview of what the Better Care Fund is for this year, and then a couple of points on our plan. So the BCF for 25-26, the government's committed to reforming and strengthening neighbourhood services across health and social care, with the goal of providing more care closer to home, increasing the focus on prevention so that people are living healthier and more independent lives, and harnessing digital technology to transform care. And so the objectives for this year reflect the government's commitment to reform via a shift from sickness to prevention and from hospital to home. So there are some priorities set out for 25-26. So the two BCF objectives are Objective 1, which is reform to support the shift from sickness to prevention, as we've said, and then Objective 2, which is reform to support people living independently and the shift from that hospital to home. As part of this year, we've got 3 metrics as a BCF plan that we need to meet. They are emergency admissions to hospitals for people aged 65 per 100,000 population, an average length of discharge delay for all acute adult patients, and long-term admissions to residential care homes and nursing homes for people. So, and as part of this and putting forward our plan, we have 4 national conditions that we must meet. Every year they are joint plans. We must implement the objectives of the Better Care Fund, comply with our grant and funding conditions, and then new for this year is complying with oversight and support processes. From a Lincolnshire perspective, the documents have been attached to this report, and they include our kind of finances, expenditure, the narrative, and then the schemes for 25-26. We are continuing on with our focus on discharge, home first, prevention and neighbourhood, so we're continuing the work that we've already been doing, using the kind of same schemes that we did previously. This work, as Martin has said, doesn't really tie in the deadlines with the Health and Wellbeing Board in terms of when they need to be submitted. So this was submitted by a deadline of 31st of March, which was signed off by the chief executives of both LCC and the ICB. So since we've submitted that, we've had some initial feedback back from NHS England and the DHSC. So the East Midlands Assurance Panel have recommended our plans for approval, and this has been endorsed by the Regional Director of NHS England. They're pleased with the progress and continuation of the 24-25 schemes, and pleased with some of the further innovations that we've got planned for this year, in particular looking at things like regards to falls, discharge planning, and also some of the outcome of the target operating model work that we've been doing. They've also asked for us to do, which again is a real positive, that looking for us to share some of the learning that we've got in Lincolnshire with other health and wellbeing boards throughout the year. And just the final point, so there's a couple of areas they'd like us to look at, which we've already started working on, in particular around some of our capacity, around pathway 1s and 2s, looking at our kind of average referral times, and also looking at percentage of patients discharged on their discharge ready dates. So we've already started doing some of the work into that, some of that feedback. They would like us to look at this as we go throughout the year, and throughout the year we report quarter 1, quarter 2, quarter 3, which will all come to the Health and Wellbeing Board for review. We are doing some of that work now, as I said, some of it we need to better reflect into our narratives, but we are working already with the ICB and looking at the NHS planning, but also the introduction of Optica, which is a patient tracking system, into some of the hospitals will allow us to understand some of our delays and some more of our data around that. These areas are also going through the Joint Commissioning Oversight Group, who will then retain oversight of this work to ensure that we are continuing to improve and action is taken. Thank you.
Could I just add one thing
Yes,
to what Paul has said? So I mentioned that the Better Care Fund has been with us for a decade or so. There was some question as to whether it would continue following the recent spending review. The recent spending review confirmed that it would continue. We therefore expect it to continue for at least another 2 years. However, there are indications that there may be some fairly significant changes to the shape and the guidance around it. Those are still being worked through by the departments. So worth noting, therefore, that not only will we need to bring the delivery of the 25-26 plan back to the Health and Wellbeing Board on a regular basis during the course of this year, we should also provide updates on the emerging policy and therefore what it might mean for Lincolnshire as that becomes clearer. But at the moment, beyond saying that we think the Better Care Fund will continue, possibly with a new name, we don't know, there isn't an awful lot of detail that I can share at this stage, but we'll bring that when it comes.
Thank you, Martin. Thank you, Paul. And I was just going to ask a question along those lines, Martin, so you've answered it for me. Do any other members have any questions for either Martin Sanders or Paul Summers? Councillor Woolley.
Thank you, Chairman. Not so much a question, but more of a comment. And I really would like to suggest that new members of this committee perhaps look at page 273, and where you see the funding sources, and you see, and Martin has touched on it, but the additional contributions and the additional contributions from our NHS partners with our local authority partners, that has come about because we have worked on behalf of all of our residents in the county for the good of our residents, not for the good of our organisations. And it should be commended because, again, as Martin has said, we are one of the very few in the country where we've got that sort of relationship and that sort of additional funding. So I would just like to thank officers for all the hard work that they've put in to ensure this success. Thank you.
Thank you, Councillor Woolley. As a new member, that's very helpful. I hope it is for other new members as well. Did Martin, did you want to come back at all on that?
So, I mean, I think very, very grateful for the appreciation shown. A number of officers, particularly Paul, do a great deal of work on this. As I mentioned, we have been looking, and Matt Gaunt and I have been looking very closely at the benefits that come to Lincolnshire from the joint work that we do, and trying to make sure that the additional bureaucracy that is involved in putting voluntary contributions into the Better Care Fund is not greater than the benefit we get from working together. I think we're very clear that we want to work together closely. Whether doing it through the Better Care Fund is the best way to do it is an issue that is under review, but we'll await and see what the new national guidance says, because some of those decisions may be taken out of our hands, but we will see.
Thank you. So we are invited to note the update provided on the 25-26 Better Care Fund submission as outlined in the report. If I could ask for somebody to... No, I won't. Oh, thank you. If I could... Matt Gaunt's proposed that. Could I have a seconder, please? And Councillor Collier. Thank you. So all those in favour? Any against? Any abstentions? Thank you, that's noted, thank you. We now move on to item 10A of the action log of previous decisions. This item was circulated as part of the agenda pack on pages 281 to 284, and it is for noting. Do any members have any comments or questions? No, then if members would just like to show by way of hands that they are happy to note that. Thank you, that's noted. Item 10B, this item was circulated on the agenda pack, pages 285 to 286. This is the forward plan. If any members have any items they'd like to propose for inclusion in the forward plan, could they please either share them with us now, or alternatively, if Health and Wellbeing members would like to contact Alison Christie, and these can be added to the plan. So would any member like to comment at this stage? No? Okay, so thank you, that is noted. And that, ladies and gentlemen, concludes the business of this meeting of the Lincolnshire Health and Wellbeing Board, and thank you all for attending. There'll be a short, very short interlude while we switch off the live streaming before we reconvene as the Integrated Care Partnership. Thank you.